Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster. My guest today is Keelan Swain, the CEO and co-founder of Greens. Like the hat, love it. Keelan, great to have you in the studio.
Howdy, Logan.
Yeah, it's great.
How you doing today?
I'm doing great. I get energy from folks who have energy like you.
I'm going to give you the energy then, if that's what you need.
I'm feeding off of it. It's been great to watch your journey.
Uh-huh.
You're helping folks with type 1 diabetes through your app. Just let's start with what you've built. What is Greens?
So Greens is a mobile health app and SMS service.
Okay.
And the way it works, the tagline you say is like, we're scaling this to vulnerable communities.
Okay.
It's a 3-part program where one of the most unique value propositions that we actually discovered in Startup Health T1D Fellowship, name drop,
Yeah.
is group-based care.
Okay.
So a part of our platform, a mobile app, is that you're paired. You have to do it in pairs. So for example, if you have type 1 diabetics, your type 1 diabetes, that means you have to do it along with your mother or father or spouse. And that has significantly improved adherence rates. So you get paired in the app, and the reason you're paired is because we advocate for all of our patients, unfortunately, to get continuous glucose monitors, right? And also do nutrition tracking. Unfortunately, the patients that we save or we want to serve, they don't know why they should get continuous glucose monitors.
Okay.
They don't have the proper paperwork you have to fill out when you're talking about Medicaid to get these monitors. And so we advocate and make sure they get that. But once our patients have those glucose monitors, right, we're monitoring when they eat, and we're monitoring nutrition tracking via the application, and we send that information to the parent and to the patient. So it's a circle of care.
It's accountability.
Extreme
Yeah,
accountability. And there's some other cool psychological terms involved in it, but accountability is the most easiest way to think about it.
It's really interesting you're tackling this vulnerable population piece because there's a lot of amazing type 1 diabetes innovation happening, and yet what you just said was that even in the United States, in an advanced country, we've got communities that aren't taking advantage of continuous glucose monitors, sort of the top standard of care. It's out there, it's even being reimbursed, and yet people aren't taking advantage of it. So let's get everybody up to the standard. And before we even start thinking about crazy 5 years out, 10 years out, let's make sure we're all getting the best now.
Yes.
How'd you get into this sort of passion area?
Yeah. One of the things my grandmother told me is it's not an advantage unless you take your advantage of your advantages, right?
Okay,
so
okay.
I want to start
That's a
there
good one.
and double click on that because I appreciate you said like upskill the masses who aren't even aware of the power of CGMs. We're talking about insulin pumps, right? That's a huge niche, but there's still a huge market at the
just basic data
on the lower level. Basic
just
data.
Get your data.
Get your data, and you got to convince them why. But I started it right as a passion project. This is the third business in the past 7 years, and I said for this third thing I'm gonna do, I want it to be impactful. I just don't want it to be a money grab or a B2B SaaS type of company.
Were you always in health or tech or?
I was in tech.
You were in tech.
Previously I worked at NASA as a 19-year-old.
Okay.
And a joke I tell people at 18 they offered me a job, but I wanted to launch my own app or be a baseball player.
Okay.
Right? And so I struck out that season a ton at Prairie View A&M University. I love Prairie View, but I wasn't a good baseball player there. And the app I released into the market was about physical health. I only got 300 downloads.
Okay.
So then next year I was like, let me work for NASA and up my skills.
Okay.
But that journey and all the companies to now, it really went into a personal story of mine of my dad. He was 3 years ago during the pandemic. He gained pandemic weight. And he got diagnosed with type 2 diabetes, right? And so this has been apparent in my family. About 30% of my family either had diabetes of some sort. Type 1s and type 2s are like some type of heart condition. So I didn't take it personally because they weren't my dad, right? There was aunties, uncles, cousins. That's not my problem.
It's so prevalent today.
It's so prevalent, especially in the black and brown community. It is extremely prevalent, and I wanted to make that aware. But he got it, and then he went to Medicare Advantage, 65 and up. He went to his nutritionist, first thing he went to. They appointed him to, and the nutritionist told him, like, hey, you know what? You should eat more kale.
Kale.
My dad's like, he's a 65-year-old black guy from Mississippi. He's like, what the heck is a kale, okay? But he did know greens collard greens, mustard greens, and that really helped them out for the first 8 weeks.
But that didn't really translate to the nutritionist very well?
No, it didn't translate to nutritionists very well. It was just a lack of, cultural competency on the nutritionist side that I identified. That was a big aha. And then just looking at most of the marketing and nutrition space, there's just a gap. So, for African Americans, it may be comfort food. That's what we're used to. But Latinx, it may be how do you do that with his Latin food or Indian food. And so every culture has their own food types, but it's not necessarily the American way or Californian way or New York way or, the base of nutrition. But
I just talked to somebody.
Yes, go for it.
Where a nutritionist told somebody who was from Mexico, like, stop eating tortillas.
How?
There was no conversation of what your life could look like with this cultural sort of paradigm.
Yeah.
Just cut it out.
So the thing that really helped my dad be long term is one of the inflection points on why we do groups is my mother. So my mother, he fell off the bandwagon after 9 weeks. It's a diet. Like fad diets don't really last unless you have a strong system. My mother was like, you know what, Tommy, we're not gonna allow you to, lose your legs or lose your eyesight or get CKD, chronic kidney disease, right? Which startup companies are here talking about today. I'm gonna do something about it. So she started to adopt the diabetic diet.
Okay.
And she started to understand.
Buddy system.
Yes. She bought nothing but, keto-friendly, low-carb meals is in the pantry. Through all the other ding-dongs, all the other barbecue sauce with 20 grams. I'm from Texas. We love barbecue, but we put too much damn sauce on there, right? And clean the refrigerator and start to learn how to cook in that way. And systematically, he was able to do that for 2 years straight because, unfortunately, he had no other options.
Yeah.
And so we see that as a huge opportunity at scale in the diabetes community. It's not for everybody. Everybody doesn't have a pair or group that they can work with, but it's a good start to create a strong system that's culturally inept from somebody who's influential. So in our T1D market, there's a ton of mothers, right, that love their kids, that don't want to see their kids in the hospital. But there may be a small gap in how to properly and systematically cook, educate, and medicate their kids in a way that doesn't make them feel like a helicopter mom.
Yeah.
And so we like to be the mesh in there, Greens Diabetes Companion, where it's a team sport. I play baseball. I love team sports. I'm a firm believer in it. And my goal is to scale it, right?
Yeah.
And as long as there's a mother or spouse involved, I think we have a strong shot of doing something extremely
a loving
impactful.
family member. Talk to me about how the market has responded, your traction. I see the Techstars t-shirt. It's exciting.
Yeah.
And kind of what's coming next.
So we've done multiple pilot programs. We're on our version 2. We've been able to get above a 50% adherence rate. That means for our patients, we can take their medication every other day, which is phenomenal. The standard is 30%.
Okay.
So insurance plans have been taking us very serious when we say 50%. They be like, oh, what? Really? Prove it. So we have 2 letter of intent with MCOs. That's our, go-to-market strategy. Medicare, MCOs are managed care organizations that manage Medicaid members.
Yes.
We're currently launching in the state of Texas, Howdy, and Alabama. That's a huge healthcare desert in the Southeast. And we're constantly looking to add more managed care organizations to our pipeline because that's what the masses are. That's what a major distribution of our diabetic patients are. And we want to, we want to be right there. And like you said, that group, what we know there's a pattern, there's a huge inequity. And it may be on the CGM health literacy or tech literacy, or maybe on the transportation issue to go to a pharmacist or go to the doctor to get the education. But the providers are low in these states, but the demand is extremely high. And the Greens want to be able to really close that gap.
Are you finding that the appetite for innovation is growing with these MCOs and the people you're talking to?
Yes, because MCOs are inherently value-based. And they get judged on outcomes, right, and not necessarily fee schedules in correlation to health systems. If you have a program that is competitive and better than their stats, and you have something to say we can reduce A1C or we can help hit these HEDIS scores or utilization scores, you're going to get you just got to be able to prove it.
Yeah.
So all the IP, all the support, all the resources is really doubling down in our own pilot programs and improving that this thing works. Because to be honest with you, there are a ton of digital health companies, but how many of them actually work?
Yeah.
at scale.
Yeah.
Like that's the novelty. It's not, we have AI in it. I didn't talk about AI. We have all these little different things.
Yeah.
But does it really
Does it
work
work?
for the community you're trying to serve is what we learned. And if
Awesome.
you can show that, man, the sky's the limit.
Yeah. Well, Keelan, I think the sky is the limit. Thanks for coming by for an update.
Thank
It's
you for having
exciting
me.
to see how you grow. I know you're still in the early innings.
Yes.
You played baseball.
Yes.
And
good. Okay. All right. Yeah.
but you're doing great work, and it's gonna be exciting to see what you do next.
I'm excited to
Keep us up to date.
Yes.
Next time we do this, I'll be excited to see you.
Next year
who's
we'll
gotten
have
in
any more
line.
resources, right?
Exactly,
We'll do it
exactly.
again. How about that?
Are you raising?
No, we just closed.
Fantastic.
So we just closed our early stage round with Techstars,
Fantastic.
Jumpstart, NSF, all
Okay.
of my initial
So
backers.
now you can just work on your.
I can just work on the thing.
go to market.
Exactly.
All right. Thanks, Keelan.
Likewise. Good meeting you.
Take care.